documentation is a very integral part of the quality, very integral part of the continuation of care, very much integral part of NABS standards, and also shares the amount of involvement towards the patient care. The documentation is a very, very important part what a nurse and what a ICU practices we look at, because most of the time when you actually deal with files later on, you see there are a lot of things are missing: the documentation part, the critical events, some stat orders, some procedure documentation, some fluid resuscitation, some critical lab values. So as a nurse, we must document and we must ensure documentation through doctors or through the resident team, so that the continuation of care is being reflected, stat orders to be documented, any new critical event, hypoglycemia, fever, hypotension, initiation of vasopressors, CPR, everything has to be documented in places, so that the documentation is very important, as well as for the quality assessment and as well as for meeting of the NABS standards and overall improvement of the patient safety and quality of the services. Lack of equipment readiness is also one area where we feel we must improve on, because most of the time when you're faced with a critical event, most of the nurses start reaching to the common site where you feel there is a catastrophic event or an emergency. But a good nurse is actually mentally prepared, physically prepared, and they can also foresee the need of equipment readiness. Like in case of an intubation, a good nurse is actually prepared with difficult intubation, although the intubation looks easy. So we must ensure there is intubation cart in place, endotracheal tube in place, you have working suction in place, the drugs which could be required in intubation are in place. So that is how we need to be prepared. Like you are inserting a central line, you must get your ultrasound machine, you must get your sheath or the plastic sheath for sterility, we must get your solutions, we must get your suture material, sterile drapes, CVP tray, positioning of the patient, handling and post monitoring during procedure as well as post procedure, documentation of the same facts, and handling the CVP lines. So we must be mentally prepared to handle the equipment readiness, because at times of critical events, your equipment readiness can actually save lives. We must be aware, like if you are giving an ambu, it has to be connected with vein circuit, or if you are using a vein circuit, it has to be connected with maximum flow. Ambu mask, if you are utilizing, it has to be connected with oxygen enrichment. Every time you are doing suction machine has to be ready with an appropriate suction catheter in place, Yonker suction in place. So that is how we prepare equipment readiness. If you are intubating a patient, simultaneously you have to arrange the ventilator, arrange the vein circuit, so that the next step is subsequently taken care. Ensure stethoscope is around, ensure ultrasound machine is around. For all the procedures assessment, what we look at, these things could be required in case of management of any complication or management of any catastrophic event, if at all it happens. So that is also a staff readiness or preparedness for handling an emergency situation. And over a period of time, what I feel, a staff should be very good at communication, because most of the time a staff is handling patient as well as family, as well as communication with the other staffs, communication with the residents. So a good nurse should be very good at communication. You have to learn to be polite. You have to be aware about the patient surroundings. You have to be aware about the patient's whereabouts. We have to be very much well versed with the clinical condition of the patient. And in case if you feel something is beyond your scope of understanding, ensure these things can be taken care with a doctor's communication. So these small efforts can actually change the outcomes and actually change the spectrum of practices. Also, handover of information is very important component, because when you are giving overs to the next staff, the same handover has to be documented. All critical events has to be documented. Medication, so all small details has to be shared to the next nurse. Anything which has been pending in that shift has to be shared appropriately. It has to be documented so that the next staff takes over and tries to finish that. And if anything is still left, there are team leaders, there are nursing supervisors to take care of the processes. So these are some things which I I have learned over a period of time, I have experienced and seen small efforts can actually results in big outcomes. So all these mistakes or small observations, if you do it appropriately, can have huge, tremendous outcomes, benefits in terms of improving the critical care outcomes, handling difficult patients, handling difficult families, and overall survival of the sick patients in emergency and critical care areas.